Good morning, everyone. If I could have attention, please. I'd like to welcome you all to the meeting today. Thank you all for coming. My name is Mia Fitriani, and I am hospital manager. Let's begin. The aim of this meeting is to talk about preparation of services for COVID-19 infection. The first time on agenda is introduction to COVID-19. COVID-19 is a new strain of virus that has never been previously identified in humans. Clinical manifestation usually appear within 2 to 14 days after exposure. Signs and symptoms of coronavirus infection include symptoms of acute respiratory distress such as fever, cough, and shortness of breath. In severe cases, it can cause pneumonia, acute respiratory syndrome, kidney failure, and even death. Let's move on to the next item. Things that need to be considered regarding the care of people in COVID-19 monitoring in the household. Place the person in a separate room, or if this is not possible, place it as far as possible from the sick person. For example, sleeping in a separate bedroom, limiting contact with sick people as much as possible. Try to have the separate bedroom for the patients, but if this is not possible, the common room must be well ventilated and have adequate lighting. You can also install exhaust fans in bedrooms and kitchen for improved air exchange. Environmental cleaning is very important to prevent indirect transmission, especially in shared rooms. Use a different cleaning cloth for the patient's room. Wash and clean with water and detergent after use. If close care must be taken to the sick family. The patient must cover his mouth or nose with a mask. Caring families should also wear surgical masks or the best available protective equipment to prevent respiratory droplets when in close contact with sick people. Tissue used to cover the mouth or nose should be thrown in the trash. Direct contact with body fluids. If contact occurs, do so after washing hands with soap and water immediately in contact with body fluids. Hand hygiene can be done by washing hands with soap and water or an alcohol-based hand rub if the hands are not visibly itchy. Now, we come to the Tugas or hospitals can treat persons under COVID-19 monitoring. Place the patients separately from other patients. If possible, place the patients in one room per patient with a separate bedroom. Prepare a space for isolation with adequate ventilation and controlled one-way airflow, where air should be directed from the treatment to an open area outside the building. Away from areas used for passing people, the door to the room must always be closed. Immediately refer the patients to all referral hospitals. Provide information at the referral hospital that will refer patients. The final item on the agenda is the things that need to be considered by the referral hospital, namely, considering that COVID-19 is a new virus, the transmission of which is still unclear, then place the patients in an isolation room with caution in case management to be distributed by air or airborne. The air conditioning system in the airborne isolation room is designed with an air change of 12 air changes per hour and is equipped with a HEPA filter. Negative pressure room. Officers caring for patients carry out isolation precautions. Before we close, it can be concluded that as medical personnel we need to know some of the point that I have just conveyed. We must provide good services preparation for all patients and can create a healthy and clean environment. Thank you all for coming.